3T's latest webinar, HIPAA Security, Translating the Technical Requirements into Technical Deployments. My name is Jake Hughes. I'm the Chief Technology Officer of 3T Systems. I joined 3T in October 2012, and I'm responsible for the technology strategy, direction, and vision in the organization. Also responsible for the overarching technology influence for our consulting and professional services, managed services, and hosted services. Prior to that, I was the Director of Partner Experience and Innovation at Seattle Children's Hospital, which was architecture and end-user experience within the clinical space. And in addition to my time up in Seattle at Seattle Children's, I was also doing independent consulting for workflow and technology solutions throughout the Pacific Northwest for hospitals and healthcare. 3T Systems is a client lifecycle company. We provide full spectrum technology solutions for our clients, including annual technology planning, ongoing client relations, and ultimately seeking to give our clients the freedom to focus. With our consulting, managed services, and hosting capabilities that we provide, we believe that we are a full lifecycle organization for our clients. We're going to start off today. We're talking about a very complicated subject, and a subject that has legal and compliance ramifications. So my disclaimer is that this presentation should not be used as legal advice or really drive in your organization decisions based solely on the information you see here. And I ask that you please consult with your organization's legal and compliance departments before making any major policy or procedure and technology changes. So I'll begin with what is HIPAA. Many of us on the webinar today know what HIPAA is, but briefly I'll go through and narrow down exactly what portion of HIPAA we'll be talking about today. It is a very narrowly focused discussion today. HIPAA's large, broad compliance set that would take much more than 1 hour to discuss. So HIPAA is the Health Insurance Portability Accountability Act, and it is a set of laws and regulations designed to ensure privacy standards throughout the spectrum of healthcare and healthcare delivery. So breaking HIPAA down into the major parts, there is the HIPAA privacy rule, the HIPAA security rule, and the transaction and code set standards. Those three things make up the bulk of HIPAA regulations, and specifically the area that we'll be discussing, narrowing in even further, is the HIPAA security rule, which is the rule that establishes the physical, technical, and administrative safeguards that are used to protect the patient information that are held within the systems in the healthcare environment. So to narrow it down even further, why does 3T care about HIPAA? Why are we putting on this webinar? We truly believe, with our focus in healthcare, we truly believe that some of the statistics on the next few pages are pretty stark, and the ramifications for our healthcare partners and our healthcare clients is significant. As an example, the HIPAA fines increased this year. One-time violations stay under $50,000. However, same-year repeat violations can be up to $1.5 million. Previously, these were $250,000 per incident. In addition to that, you have the economic impact that is aside from the fines. You have investigation costs, legal fees. If there is a breach of information, it can be as serious as lawsuits being brought against the organization. There's the downtime, the loss of credibility, and ultimately the average increase, an average increase of $400,000, from $400,000 to a total of $2.4 million since 2010 for the economic impact to organizations. So let's take a look at the data breach statistics. This statistic shows that over a 3-year span, fiscal year 2010 all the way through 2012, you have an ever-increasing amount of year incidents, so repeat incidents. So referring back to that previous slide, that means the $1.5 million potential fines per incident on those. And really what the government and regulatory bodies are reacting to is the fact that this continues to trend up. While there have been minor decreases between 2011 and 2012, the trend still has them very, very high throughout the healthcare environment. And the economic impact of these data breaches is significant as well. So the most stark statistic in this chart is that 31% of the breaches cost more than $1 million to the organization, which is an upward trend. And each year you see, or each category you see a significant impact to the organization regardless on the dollar amount that's actually noted. But more than $1 million at 31% is a very large statistic. So what can we do? How can hospitals, healthcare, and our clients improve their stance? What I'm going to do is I'm going to bring the focus into the HIPAA security standards area and very specifically on the technical safeguards. This webinar is about how to take the technical requirements and respond with technical deployments. So technology that actually gets installed and placed into your environment. I will go through briefly everything that's contained in the HIPAA security standards is technical safeguards. This is access control, audit controls, integrity controls. We'll be talking about this over the next half hour or so. Physical safeguards, facility access control, badging at doors, making sure the right people get to the right place. We won't be talking about that. Administrative safeguards, including the management, the processes, the personnel, kind of the framework that ensures that you're able to adhere to the HIPAA guidelines. And then further into that is organizational policies, procedures, and documentation requirements enforced by those administrative safeguards. Again, we'll be talking very specifically about the technical safeguards. So within those technical safeguards, getting even more drilled down into what we'll be talking about today, it breaks into these primary technical requirements. There's the requirement of access control, which breaks out into unique user identification, emergency access procedure, automatic log off, and encryption and decryption. We have audit controls, integrity, person or entity authentication, and transmission security, which breaks into integrity controls and encryption. So that is what makes up the HIPAA technical safeguards as we've drilled down into one small piece of the HIPAA guidelines. So let's go right into it. So starting with access control in our technical guidelines, it's unique identification. So we have, I've placed the quote from the Department of Health and Human Services of what they consider access control to be. And this is ultimately assigning a unique username and password to the users, anybody accessing the environment. The common solutions that we see out with our clients or with our healthcare partners is things like local administrative accounts. As long as you have a username and password, you're adhering to it. Directory-based accounts, so like a Microsoft Active Directory or a Novell directory. Application-specific accounts, so this would be in an EMR, in an Epic, in a Greenway. This would be an account specific to that application, not shared in the other directory services, or any combination of the methods above. Each one of those, we believe, comes with a caveat. So from a 3P preferred solution, what we will do for our clients, what we do for the projects that we work on within the healthcare space, is to have a Microsoft Active Directory-based account system, so all users are in the central directory. And here's where the key differentiators from a solution standpoint come into play. And that is directory integration with all applications. So getting every application, Epic, Cerner, Greenway, GE, the PAC systems, the EMR, everything that has to do with electronic patient information, all of it pulling the username and password out of Microsoft Active Directory, so out of the directory services. This includes things like LDAP, secure LDAP, Microsoft integrated authentication as a whole, and then to put the icing on the cake and make this a usable and a feasible mechanism to use for your environment and to continue to enhance the workflow even while bringing higher levels of security and compliance into the environment. We add Imprivata single sign-on with easy access tap and go. And basically what this allows you to do is ensure that there is a one point of access username and password. In addition to that, and I'll go over this in a different slide, it also allows you to have much stronger passwords and get into the system much quicker. It provides two-factor authentication even internally to the environment. Access control, we're still under that subheading, and now we're in emergency access. So paraphrasing a bit here, basically this is the procedures in the event that the EMR systems are unavailable, the records for the patients are unavailable. Could be a data center failure, could be a network failure, could be a geographic issue, a disaster. If those electronic medical records are not available, something has to be provided, a procedure has to be provided to gain access to those in that emergency. So some of the common solutions we see are exports from the EMR systems pushed to designated workstations throughout the environment, which adds a whole nother compliance issue because now you've got exports of your electronic medical record out on different workstations that may or may not be encrypted, that may or may not be as secure as you need them to be, and you may have just weakened your security posture by doing so. Additionally, we've seen EMR exports to controlled laptops and distributed in an emergency. So a laptop locked up in a specified area, in the event of a downtime or an emergency, those laptops get distributed out into the environment. Again, you've got devices that may or may not be out of your control once they're out. So certain measures should be used on those. Or we've seen probably the least efficient is EMR exports to a centralized location. Then they are printed repeatedly, and the stacks of paper are run out into the environment to provide that emergency access procedure. The preferred solution that we have is for the EMR exports to be pushed to designated workstations. This could be within the hospital units, within the different clinics, via a secure protocol. And again, we'll get into encryption a little bit later, but an encrypted protocol that pushes those EMR exports to specific workstations. And those workstations are then powered with emergency power to ensure that they're available even in the event of a power failure, and we put full drive encryption on them. And this ensures that if that machine were to be compromised, stolen, removed from the environment, that EMR data that had been pushed to it is still secure and we are still compliant. And finally, we use a local account because we have to assume that the directory services I mentioned earlier would not be available. And we call this, I refer to this as a break the glass account. It's used when and only when an emergency is in place, and it is highly controlled up until that point. So that break the glass username and password is distributed to the units when needed, and the password is controlled to a point of knowing that there's a chain of custody on it. There's a number of different ways to mechanize any one of these. I'm kind of looking at them from a high level. But this is a solution set together that ensures you have not weakened your security posture and your compliance posture, and you've maintained the compliance requirement of having emergency access procedures. Now I'll pause here for a moment and to reiterate that this is all technology solutions. There's policy and procedure behind each one of these that has to be documented. We're talking very myopically about technology implementation to align with these requirements. The next control is automatic log-off, and this is still under the access control subheading. And this is, again, paraphrasing, implementing a procedure for when somebody abandons a machine, which is very common in healthcare, especially in chaotic environments such as the ED or other chaotic situations that may arise in hospital and clinic scenarios. It's very easy to walk away from a workstation leaving it unsecured. You now have the ability for anyone who has access to those systems to gain access to your EMR. So this is basically saying if a machine is abandoned, secure it after a specified period of time. Pretty straightforward solutions we see out there: automatic log off or locking of the entire workstation, or the automatic log off or locking of the applications containing the electronic patient health information. What we see, the issues with each of those are the automatic log off or locking of that workstation. The log off may cause a user to lose information or lose where they were working at if the EMR is installed onto, or the clinical applications are installed onto that workstation. It doesn't take into account that the user may be in the middle of something and they're closed and logged off. It also adds time for them to get back into the system. And the locking of the entire workstation basically takes that workstation out of the running to be used by any of the other folks on the floor. Very similar with automatic log off and locking of applications. If it is a shared workstation, that obviously doesn't work. If it's a shared workstation and a log off happens, whatever work was being done at that time is quiesced or moved, and the user that needed that no longer has access until they go to another station. Or locking it causes the application to be in use only by that user. Or further, if it's locked within an unsecured desktop session, the user may not have direct access to the EMR applications or the applications containing EPHI. However, they may have access to other systems that incidentally, like file shares, email, that have access to your electronic medical records or your EPHI. Our preferred solution is to use the Citrix Virtual Desktop environment. This brings all of the desktops into the data center and gives you a two-tier disconnect capability, and that is secure the session by disconnecting it, keeping it alive and running on the back-end system even while it's been secured at the front-end workstation. This can be 2 minutes, 5 minutes, 15 minutes, and then a disconnected, meaning it's been abandoned. Now no longer are we going to keep this session around. Disconnected idle counter for a much longer duration. This could be as long as 12 hours, the length of a shift, to ensure that they don't lose their where they're at, no matter what workstation they go to. This is variable, and it's based on the workflow requirements. This could be 15 minutes for a clinic and 5 minutes for the ED, where some of the workstations are in public areas. So it's variable. In addition to that, the application timeouts to keep usability and to keep security from impacting the end users. The application timeouts for those applications, the EMRs, the PAC systems, would be synchronized with the Citrix timeouts. So now when you are active and idle and you disconnect, thereby securing that station that you were working at, keeping your information and your application state alive, the application would lock at the same time for an added level of security and compliance. And then we add in the Imprivata One Sign, the single sign-on with the badge access, to make it fast to get back in, but also to send the unlock to the applications that have been locked in that environment, keeping the end user from having to do that. Access control, we're still in that subheading. This is now encryption and decryption. So the paraphrase on this is any electronic health information, any patient information, any controlled information needs to be encrypted, have the ability to be encrypted and decrypted if it is going into an uncontrolled area or even in some of the controlled areas. So common solutions for this and common scenarios are EPHI that is getting emailed out. And this is extremely common because when we have partner clinics or partner hospitals, often the patient information, no matter how small or large the amount of information being shared is, that information will be sent with email. Additionally, there's thumb drives and all kinds of laptops, thumb drives, a lot of different devices that EPHI and control data can be copied to and removed from the environment. Once it's removed from the environment and all of the security controls that we're talking about, then it's open season on that data unless you provide encryption and decryption. So our preferred solution for those scenarios, and this is a holistic, is again to use Citrix Virtual Desktop with log-on and session encryption. So communication between the workstation and the data center is fully encrypted. and the session itself, the establishment and the logon credentials that are exchanged to establish that session are encrypted as well. Now, the Citrix Virtual Desktop is a key, and you'll see this throughout the controls. It's key here because it pulls all of the data off of the workstations. Anything that's connecting through Citrix is still accessing your EPHI, it's still accessing your controlled data, but none of that data resides on the connecting device. So if that device were to be stolen, as soon as that Citrix session is broken, there is no data on the device. In addition, for devices that are interacting directly with file shares containing EPHI, we would use Microsoft File Encryption Services to ensure that the files themselves at rest were encrypted, and it required an authenticated person to gain access to them. All laptops, desktops, mobile and removable devices that are not accessing your environment via Citrix would be fully encrypted. So this is full hard drive encryption on laptops, full hard drive encryption on desktops that are not secured appropriately, such as ED. I use that as an example because the desktops are typically out in a public area so that they can be accessed quickly, as well as the removable devices, thumb drives, stuff like that, being encrypted upon being plugged into the system. Optionally, and the preference that we've used with our clients and with our partners has been to disable the or the use of removable devices altogether. This takes time. It's a culture change, but it is the ultimate level of security and compliance in that arena. Also, we use policy-based email encryption to automatically encrypt based on the content. Commonly what we'll find is if you put an encryption button or require the user to do something to encrypt the data that they're sending out, it typically does not work because they either forget or it's an extra step that is bypassed. So using policy-based email encryption as well as negotiating encryption automatically between your organization and partners takes the human element out of it and ensures that anything that has either a specific content type or is going to a specific destination is encrypted. And finally, the icing on the cake on this one is firewall-backed access zones, restricting access to the machines and the repositories containing controlled information only by authorized systems, not users, but by authorized systems. So an example would be only Citrix servers can access the databases that have PHI on them because they're in the secure data center and monitored 24/7. Now we'll move on to audit controls. Audit controls is basically the need to implement hardware, software, and procedural mechanisms that record and document who accessed what, when, and how, and ensure that you have the ability to prove that the right person is accessing the right thing in the system. Common solutions on this, and I'm making the assumption that any of the EMRs or software packages that are being used to store EPHI, which is commonly the case, adhere to auditing requirements. To be a certified EMR, there are auditing measures that have to be built into the application that establish who accessed what, when, where, and how. But that also spreads out peripherally to the systems of access, and in the event of a compromise where someone gains access to your system with an account that is allowed into your EMR, there is a responsibility for you to be able to detect that and to research who it was and try to determine what level of breach that was. Common scenarios are security log auditing on servers, so just looking through logs and looking for people attempting to get in, which is only a part of the puzzle. I'll speak to that in a moment, as well as network access auditing. And so this is, what connections are coming in through firewalls, who's logging into specific devices to gain access to your system. Our preferred solution, again, uses Citrix Virtual Desktop with EdgeSite or a similar Citrix monitoring tool that tells you who connected, when they connected, where they connected from, what application they used, how long they used it, and when they stopped using it. So this is a huge amount of intelligence that you can get that goes directly toward the audit control compliance out of just the Citrix stack of applications. In addition to that, we recommend syslog, log aggregation for firewalls and switching devices, anything that is an access control into your environment to detect when they are modified, or to have an investigation trail in the event that you do have a breach. And similar to what we talked about above, security log auditing on servers, this takes it a step further and uses a centralized security event log aggregator, basically taking all of your security events throughout the environment and putting them into a centralized location, again, for investigation and to ensure that you have the information necessary to comply with this standard. And finally, the removal of all shared and generic accounts, keeping only break-the-glass accounts. Now, again, this is cultural and this is difficult. However, the use of shared accounts, if they're not secured properly, or if a mistake is made and they become unsecure and allowed access to more information than they have, you're as weak as your weakest link. So that creates a serious situation there. Shared and generic accounts are very difficult to audit against, and they're very difficult to control. Now we'll talk about integrity of your data, and this is basically the policies, the procedures, and the technologies that you use to protect your EPHI from alteration or destruction. And this could be human error, malicious behavior, or technical failures. Hard disk failing can introduce data integrity issues because it damages the patient record, thereby making it unavailable to you. So some of the common solutions for this from a technical standpoint, again, I want to remind that there's a lot of procedural solutions out there as well. We're talking about the technical ones. So common technical solutions are the use of databases that enforce integrity for all data contained within. This is very common for any EMR or any software application that's interacting with EPHI or controlled data. However, not all of them have this capability, and not all of them have it turned on. So using databases that not only use it, have the capability, but enforce it is critical. And this is a discussion with EMR or software vendors that you may have. As well as use of data integrity features on storage to ensure that if anything were to get damaged due to a hardware failure, it is either recoverable or automatically recovered. Our preferred solution is, again, very holistic, and it takes a look at the entire, rather than a hodgepodge of solutions or no solution at all. We propose ensuring that the databases used by your EPHI applications, the vendors, your in-house developers, all are configured to use data integrity features. And this may be as simple as calling your software vendor and ensuring and getting them to document that, yes, in fact, they do use integrity standards on their database. Additionally, we use storage data integrity features to ensure that data integrity problems are found on the storage subsystems and repaired automatically. This is commonly available to any storage subsystem, even those in a desktop, but are more robust when you get into the enterprise-grade storage subsystems. And we get a little bit procedural here because we can make sure that the data integrity is protected, but just in case, there's responsibilities that you have that can work with the integrity standard as well, which is ensuring that you have robust data recovery and backups, disaster recovery, I'm sorry, and backups of all of your systems containing that controlled data. So if integrity were to be compromised, if you were to lose records due to a technology failure or due to a compromise, you have a responsibility to get them back and back in time for the patients and the providers that are using them. And again, you'll see this one throughout as well, use of firewalls to enforce strict access policies to systems containing controlled data. This further guarantees that you will not have malicious attack or incidental access to the systems that people shouldn't be accessing, causing a loss of data integrity. Person or entity authentication. This is basically ensuring that the person or entity that's accessing your electronic records is the one that they claim to be. It is the individual that is logging on, rather than me using an account that I may have hacked or found a password for, knowing that it's Jake Hughes that's logging into the system. The common solutions that are, a couple of these are a stretch, are the use of password to authenticate users. This is the concept of something you know. We can also use and have seen use of smart card tokens or keys to authenticate users. That's something you have typically. Or the use of biometrics, fingerprints, retina, any one of the new biometric measures that have come out. Our preferred solution, again, every solution that we choose brings together strong security with strong usability, keeping that user experience intact and not passing the burden of security down to our end users. And it also takes it to the next degree, using two-factor internally, which is well above and beyond what most organizations are doing. And this, for us, is the solution, again, of Imprivata One Sign with a badge access with a PIN enforced on it. So that two-factor is now something I have and something I know, going above and beyond the diligence requirements of ensuring that the person or entity that's accessing the system is who they say they are. Additionally, we use two-factor externally. Our solutions are holistic. We look at your entire security posture. So use that two-factor externally using one-time password tokens, or if it's appropriate, using the same badge access, which means deploying hardware outside of your environment. And again, firewall-backed access zones restricting access to authorized systems only. This reduces exposure in the event that someone were to gain access to your system. They'll likely not be able to get access to your controlled data, so they are not a risk to your overall environment. Transmission security is basically the information as it flows from one system to another. And this could be systems that you own or systems outside of your control. And this could be things like email. I talked about it earlier. If your organization emails another clinic or another hospital and has patient information, this transmission security rule applies. So some of the common solutions, and I get a little bit geek-speaky here, are the use of an integrity algorithm. Some of the common ones are MD5 or SHA-1 at the database level. And this one is kind of a stretch. We've seen this used specifically against the integrity controls rule, but under transmission security, it is almost not applicable. You are ensuring that the data that comes into your database has a certain level of integrity, but it falls outside of the data in transit having that integrity check being done on it. In addition, we've seen the use of integrity algorithms at the network and transport level, and that's more specific to what this transmission security rule specifies. Our preferred solution is the use of Citrix Virtual Desktop in combination with the firewall that we've mentioned throughout and we mentioned again below to mitigate that unsecured traffic. So by putting everything in Citrix, by moving your applications and access into your data center, you've effectively encrypted everything, encrypted with a integrity algorithm, everything that is going into your application. That secures the vast majority of the transmission that you need to from a security standpoint. We recommend the use of SHA-1 instead of MD5 integrity algorithm simply because it's a stronger algorithm and therefore would take more time to defeat. And this is for all unsecured traffic between clients and servers. And by unsecured, I mean going out of your data center, out of your highly controlled, physically controlled zone and into your client space. Those should all be using the SHA-1 at least algorithm. And again, firewall-backed zones, ensuring that only those that are authorized, only those machines and those access points that you authorize can see your databases, can see your protected information, ensuring that even in the event of a compromise, those systems are still safe. The second piece of transmission security is encryption. And typically, I will say encryption and integrity go hand in hand. They're commonly deployed together. And this is basically implementing a mechanism to encrypt electronic protected health information whenever deemed appropriate. And the key here is deemed appropriate, and this goes back again to when are you sending unsecured EPHI information across your network. That is ultimately when you need to the appropriate time to encrypt it. Common solutions are use of an encryption algorithm at the network and transport layer. So if somebody's accessing remotely, that might be a VPN. You might use SSL to secure the traffic to, say, a website that contains information or a web app that contains information. And these are typically provided either by IT or provided by your software vendors. And they're not always leveraged throughout the environment. Our preferred solution, again, is Citrix Virtual Desktop in combination with the firewalls we've mentioned throughout to reduce the volume of unsecured traffic. So this significantly reduces how much traffic that is deemed appropriate to, for you to, outside of the virtual desktop environment, to secure with some other means. Anything within the Citrix Virtual Desktop environment, we recommend be secured with the RC5 encryption and SHA-1 integrity algorithms. Those are very strong algorithms and very hard to defeat. Encryption of your ePHI file transfers from server to server or to server to partner. So this may be commonly we see our clinical clients or partners, some of their employees using Dropbox to send data back and forth, or some other means of emailing or whatever the case may be. And that information is not only typically not encrypted in transit, but it's not encrypted once it gets to that system. So ensuring that transmission from server to server or your environment to somebody else's environment be encrypted. And there's a number of technologies that we use to do that. I won't go into detail with those. Additionally, it's the encryption of email between partners. And this one I want to highlight because this is a very, very common problem. And anybody in healthcare right now does have, typically has ePHI leaving their environment through their email system. And this is just a question of workflow and the ability to quickly get information to someone that is interacting with the patient that we may have, and that commonly becomes email. So there are, we assist with setting up encryption between email partners because that's commonly where that ePHI is going, is between somebody else that we email back and forth to regularly. And that's basically setting up TLS, which is an SSL protocol, to for all email between your organization and your partner organizations. This goes back to what I talked to earlier of not relying on the human element to make sure that it's encrypted, but doing it automatically where it makes sense. Further, like I mentioned, employing those RC5 and SHA-1 integrity algorithms between clients and servers at both the database and the network transport level. That's for everything that falls outside of Citrix has to be secured somehow with some other encryption method, which may be VPN, it may be SSL VPN or some other technology. But those are hopefully the outliers and few and far between when used with Citrix Virtual Desktop. Whew. Okay, so we have covered a lot of ground. I hope most of you are still awake. This is a huge topic. There's a lot of different things that I threw out there. And many of our attendees that are in a clinic or in a hospital are probably wondering, how the heck do I approach all this if that's just one portion of the HIPAA controls? So what should your organization do? Here I wrap up with my experience at Seattle Children's Hospital, with my experience at other hospitals that I've worked at, where I'm a very security-minded individual. I've always been involved in the security and privacy initiatives at our organizations and typically lead them. So this would be my very quick recommendation to you for how to get started, how to bring control into your organization. And really it's beginning with a formal security assessment and a risk analysis. You need, even if you have security and compliance programs in place right now, if you've not done a risk assessment and risk analysis since doing so, you don't know what your security and privacy postures are. So begin with that risk assessment. We have a number of clients that we do security and HIPAA assessments for that are honestly surprised by what they see, and they went into it thinking that they're in a pretty good security and privacy posture. It's the little things, it's the technology things, and it's the people and process failures that ultimately undo that assurance. So work within your internal IT or an external IT group to identify, assess the risk, rank the risks and threats to ePHI and critical systems, and then begin working on the high criticality and high risk elements. And look at all the aspects. A lot of what I talked about in here was security control and security mechanisms and ways to secure data. And we often forget that a part of this rule is availability. We have to ensure that our systems are available to be used or we are no longer compliant with the regulatory requirements. So availability, both in a high availability instance in the data center, but also disaster recovery, to take it beyond the walls of the data center, are a responsibility of every organization and are a part of HIPAA. Ensure that integrity is maintained both at a technical and at a human and administrative level, and confidentiality is maintained throughout your entire stack. And examples of confidentiality outside of what we're talking about from a technical standpoint, like locking your workstation, may be as simple as use of privacy screens in public areas so that a patient standing next to you can't see the information unless they're standing directly in front of the monitor. So there's a lot that goes into these. And ultimately manage and mitigate the risk that you find with these security assessments and these security audits. And respond with implementing a security plan that encompasses everything that we talked about originally, the administrative controls, the physical controls, the technical controls. Even if you have a security plan in place, ensure that it's modern, ensure that it's up to date, and ensure that it is accurately improving your posture rather than simply being an exercise that you go through. Examine the risk and existing mitigating controls carefully and holistically. A lot of what I talked about today wasn't just mitigating for one specific technology, but it was taking a look at how can we do this for the entire environment, such as two-factor. We advocate using two-factor both internally and externally because it has such a significant impact on the posture for privacy and security. And deploy the technical solutions and controls to reduce the human element. That was also a theme throughout of don't rely on individuals to click a encrypt this button. Use more sophisticated technologies as technical bumpers to ensure that compliance is maintained and IT is allowed to fade into the background and let our clinicians do what they're there to do without having to think about it. And ultimately, educate and train. Your goal is to build a security and a privacy culture. It's to breed the knowledge and the understanding throughout your environment that makes sure that everybody's focusing on security and privacy. And it's not a four-letter word, it's embraced. And it's embraced because it not only makes their lives more secure, reduces risk to them individually, but also is combined with enhancing their workflow and their experience. So that is the end of the webinar. I appreciate everybody saving their questions. We do have chat enabled for all of the attendees right now. Any questions? We've got about just over 10 minutes left. Any questions or points of clarification that you'd like to have, please do send them through chat and I'll address them on the webinar. I've also provided my contact information if you would like to follow up, get more detail about solutions or just discuss more of what this type of plan entails. So it looks like we have no questions right now. So we'll leave the call open for a few more minutes. Anybody that does have questions, feel free to type them in. I thank you for attending today, and I look forward to any feedback or anybody reaching out if you have any questions.